So in this situation, I'm going to remove this crown first. How do you remove a crown traditionally? Well, you probably all take some type of carbide burr or diamond burr, and you section the tooth on the facial, on the occlusal, and on the lingual, and you take an instrument and you take it out in pieces, right and left pieces. And that's fine. You go through a lot of burrs. You do it Bruxer. It's pretty tough. You know, you go through $40 of burrs trying to remove a Bruxer crown. Another great instrument that Golden Dental Solution has in their inventory is something called a WAMkey. It's something, again, it's just a remarkable instrument. I love instruments that make my job easier, more efficient, more predictable, simple. We all remove crowns. I know we don't remove our own crowns. We never remove our own crowns, but we do remove other dentist crowns all the time. Again, you would cut it all the way through and remove it. You would, if you're going to save this tooth, you would re-prep it, and your staff would sit down, or you would sit down and make a temporary. How long does that take? How much chair side does that take? Well, with the WAMkey, we're not cutting through the entire crown. What I'm going to do is I'm going to make a small elliptical opening in the facial aspect. And this slide here is showing that I want to penetrate through the crown, through the central groove of the tooth at the level of the preparation. Well, you may say, well, where's the level of the preparation? How do you know where that is? Well, normally you don't know exactly because you can't, an X-ray won't go through it, but normally it's going to be on the occlusal third of the preparation, normally. So what I'll do is I'll take a burr and I'll just make a small elliptical opening in the facial aspect of the crown. I will then take my WAMkey, and there's actually 3 instruments, a small, a medium, and a large, 1, 2, 3, and I'll place that instrument into the crown at the preparation level, and I'll simply rotate, and boom, that crown will just come right off. Again, magic. Not a lot of work. It works great with Bruxer. You just have to make a small opening instead of trying to remove a whole crown. Now, in this situation, this particular situation, this tooth was deemed non-restorable, as I said. So we're not going to use this crown as a temporary, but if the tooth was salvageable, if you were just re-prepping it, you could reline that and use that as the patient's temporary. So the WAMkey, again, is a predictable way of removing crowns. Use less burrs, less wear on the handpiece. You can use the old crown as a temporary. It's just darn easier for us.